back.
Mr. Thompson.
Thank you, Mr. Chairman. Thank you to the witnesses for being here today. I think it's pretty clear that too many Americans can't afford the insurance they need to even see a doctor, and this has got to change. Last year, congressional Republicans cut $1 trillion from Medicaid, and they failed to extend the enhanced premium tax credits to make insurance more affordable for middle-class Americans, all while they added over $4 trillion to the national debt to give a huge tax cut to corporations and some of the wealthiest people in our country. Now, 15 million Americans are losing their health care coverage. Some clinics and hospitals have already closed. More will be forced to close their doors this year. And I'd like to submit this article outlining some of those closures to the record. Congressional Republicans also failed to extend the Affordable Care Act's tax credits, and hardworking Americans' health care premiums just doubled or even tripled in this new year. You know, I've supported Medicare Advantage. But some of the actions by some insurance companies, some that are here today, are very, very concerning. And I have 3 articles I'd also like to submit to the record, Mr. Chairman, on that issue.
Without objection.
These articles show that insurers are abusing Medicare Advantage. In one disturbing example, the Wall Street Journal noted Medicare Advantage companies are exploiting our veterans. And thank you, Mr. Doggett, for your legislation. If I'm not already a co-author, please add me to that. I'm a combat veteran, and I use the VA services myself, and I get great care from them. But many of my fellow veterans are preyed on by insurance companies who get them to sign up for Medicare Advantage programs, despite that the veterans get all of their care from the VA, and they're not reimbursed. VA is not reimbursed. According to the Wall Street Journal, 1 in 5 veteran members of Medicare Advantage plans did not use a single Medicare service in 2021. Care provided at the VA is not billed to Medicare Advantage plans, which means your companies are collecting taxpayer dollars without providing a bit of care to many of our veterans. 82%, I want to talk about prior authorization because it's also concerning. 82% of physicians reported that patients abandon needed treatments because prior authorization requirements are too burdensome. The American Medical Association says that authorization delays have led to serious adverse events for their patients. And according to the California Hospital Association, nearly 2/3 of prior authorization denials are overturned on appeal. Prior authorization increases administrative burden and for our doctors, and it's bad for our patients. And that's something that I believe you can do something about. So I have a question for all of you. Prior authorization is causing these problems, and many of your companies use AI algorithms to categorically deny care that must then be appealed without the input of a physician. I want to know what you're doing about that and how you can address it. And Mr. Hemsley, we'll start with you and go right down the line.
Thank you, Representative. I think that is a great topic to bring forward. Our organization is focused on making the complexity and disruption of prior authorization much smoother and much easier. We do not use AI for anything other than administrative purposes. It is not applied for clinical applications whatsoever, and we are advancing an effort to really make the authorization real-time and digital. Less than 2% of our total interactions require any authorization at all, and the overwhelming majority of those are administrative. Those are usually resolved. They are usually resolved by a document or something like that.
We're quickly running out of time, so if you could hurry along.
Well, only that we are definitely in alignment with you on this. We would like to make this much more intuitive, simpler, modern, and we are on that course. We have 4 projects in the market today piloting this effort, and we also want to bring it to the rural community where we think we can expedite the flow of funds and bring some relief to those communities.
Congressman, we agree with you. We do not use AI to deny care, and we also believe that there are opportunities to improve the prior authorization process. We're committed to it, both reducing the numbers as well as improving the data sharing with the providers to take the patient out of the middle.
We also do not use AI to deny claims or to deny prior authorizations. We also have clinicians involved, and we are committed to continuing to improve in the commitments we made, and we want to share data with care providers to make this safer, more affordable, and more connected, and we think there's a big opportunity to do that.
Congressman, in the commercial business that we operate, in excess of 95% of all the claim experiences have no prior authorization. For those that do, we've been able to successfully use AI to get to yes rapidly, and now we have almost 78% of all those prior auth that need to transpire taking place immediately, but it is never used for a denial.
We have not and will not use AI to deny care. Prior authorization process today sucks. We all take accountability for it. We are fixing it by reducing the number of services that are covered, offering an online service, and standardizing electronic submission of data.
Thank you. There's a disconnect, Mr. Chairman, because the doctors that I talk to and hospitals I talk to are telling me something a little bit different. So I'd welcome the opportunity to work with you to figure this out and see if we can fix it. Thank you. I yield back.